Breaking news. Hi, I'm Aaliyah McMullen, and there is a disease sweeping across our nation that affects about 3% of young adults in the U.S., and it can lead to death about 10% of the time. It's a mental disease that has dire effects on the physical being. I'll be talking about anorexia nervosa and how it affects these young people mentally and physically. I will also talk about the prognosis and treatment for the disease. This disease affects many young teens in America and is becoming quite the epidemic. Too many people have died from anorexia, and the amount of people with the disease is not lessening. I'll first describe exactly what the disease is and how many people are affected. Then I will discuss symptoms and how it affects the body mentally and physically. Then I will talk about the prognosis and the treatment for the disease. Anorexia is an anxiety and emotional disorder. There is an obsession with what they eat, and they have a phobia of gaining weight. They want to be at a weight that is well below normal, and they are perfectionists and may have obsessive compulsive disorder. Most people with the disease have had a traumatic experience in their life that has triggered it. Athletes have also been found to have the disease because they are also perfectionists. Anorexia is a disease that is not lessening. It is increasing, mainly because of society, and because society has provided a social stigma where everyone has to be thin. Now I will discuss the symptoms and how it damages the body. First, there are some risk factors of the type of people that will develop the disease. Anorexia is more prevalent in young teenage girls and young women. This disease often occurs after puberty. Many people with this disease experience depression and cannot deal with stress well. Symptoms are intense phobia of gaining weight, having a distorted body image, like the picture seen here, women who have not had their menstrual cycle for more than 3 months, and the damages that happen to their body are loss of bone density because of not getting enough nutrients and having heart problems as well as low blood pressure. If someone cannot beat anorexia easily, there are a few ways to kick the disease. I will talk about the prognosis and how to treat the disease now. It is a lethal disease that leads to 10% of deaths of the cases. Medical treatment include starting the patient on a weight gain program where they have to gain about 1 to 3 pounds per week until they are healthy. This should include scheduled eating times, and the patient should also engage in more social activities. If the patient is severely malnourished, like the picture here, which is about 70% below their target weight, then they may have to have a feeding tube into their stomach or be fed through an IV. Counseling also is very helpful when treating mental disorders such as depression or dealing with a traumatic experience in their life. That may also help treat anorexia. Now that we have gone through the statistics, risk factors, symptoms, prognosis of the disease, and the treatment, I hope that you can diagnose yourself or someone else. Remember, someone you may know could be struggling with this deadly disease.